We're talking with Dr. Gregory Turowski, a renowned Harvard-trained, board-certified plastic surgeon. Now, you have almost 20 years experience in plastic surgery and are well-respected for your surgical skills and natural results. What prompted your interest in hair restoration?
I was looking for the good procedure for hair restoration, and I wasn't really happy for first 20 years, because there is really no good procedure until the follicular unit extraction show up. I know it's a medical term and you probably don't know what exactly it means, but what it means for patients is that they don't receive a large scar on the head, and they have an easy procedure to go through. So if that is possible, that opened our whole new arena for hair restoration, and that's where I got interested in this. And we started with the new technology that showed up several years ago. It's almost 5-6 years ago. It was called NeoGraft. And that allowed us to do the same procedures, the hair restoration procedures, without creating very visible, conspicuous scars. So, and that was further advanced by the development of robotic hair surgery. And that's really what we're doing mostly now, is using robots, very advanced technology to do hair transplants.
Okay, now who can benefit from the hair restoration procedure?
I think anybody who is unhappy with the hair is a potential candidate. There are some pitfalls here. Of course, you have to have enough hair, because you have to have enough hair to transfer. We are not producing hair, we are transferring hair. So we have to pick the hair from the so-called safe zone, and the safe zone is in the back of your head and anybody's head, because even the baldest people have usually hair there. They never disappear. So this is a safe zone that allows us to pick up hair that is permanent. So if you transfer this hair, they stay permanently in new place. Now, there are also solutions now because of these technologies for people who have run out of the hair. They don't have enough hair on the scalp. We actually can use body hair. So we are actually doing body to scalp transfers, and we can actually take out the hair from the chest or the back or the legs and transfer to the scalp.
A lot of patients are afraid to undergo a hair transplant. Can you describe what a typical procedure looks like and what patients can expect from the process?
Yeah, I think this is a serious problem, that a lot of men, especially men who are not typically involved in cosmetic surgery that much as women are, they are afraid. They're afraid of the procedure itself, and they are afraid of the results. So procedure, it's actually much easier to go through than with the strip method, because there's virtually no pain. It's very minimal pain. So even the next day, patients have minimal pain, and so that takes care of the fear of the procedure itself. But I think what you also meant is how patients are afraid of the results, and I think, and here is as usual, the devil is in the details, and it has to be done right. And the problem is that we all seen on the patients that were done before is that you look like a doll. You have this bunch of hair put together like a plug, and that obviously is not natural look, and you can know right away that this is not natural hair. What we do is to put the hair in the either single hair or in the small bunches, and in front it has to be single hair. And if it's done in the right way, in the right angle, and that's where the artistry and the experience comes in, is virtually undetectable. How
soon can a patient expect to see results?
Yeah, that's another issue with the hair transplant. You have to be patient. It's something that I sometimes compare to being pregnant, because you're really putting this hair in, and you have to wait about 6-8 months before you actually see the nice result. Some patients actually see growth about 3-4 months. So at that time you may see a little bit hair coming, and they start like a baby hair, then they get thicker and more dense. And I would say up to a year, you get improvement. So really the final results are about a year. But yeah, it happens slowly, and it happens in a very natural way. So it's kind of interesting that a lot of patients told me that their friends and family, they forgot that they ever were bald.
So this is the big question. A lot of guys worry about the results. Is it going to look natural? Will anyone notice that the procedure was performed? Are they going to look funny? I mean, what should they expect?
Well, hopefully somebody will notice, because that's why you do these procedures, to look better and to be more confident and to have better life. And that's why a lot of patients are concentrating on how many hair are we going to transfer. And we transfer to as many hair as we can make you look better. So this is the most important. And fortunately, with these new technologies, we have two things to offer. One, no donor scars, so there is no fear of having the stigmata of the scar in the back when you sit in a plane and everybody behind you knows that you had the procedure done. And the front, as I said, it's all in the artistry, or it's how you put the hair in. And I think if you do it right, if you do it in a certain zigzag fashion, a little bit asymmetry comes in, it's really undetectable. It's really something that it's very hard to notice, even for patients that know what they are talking about, or even for myself. I frequently see patients in consultations who had previous procedure. I walked into the exam room and I know that they had the procedure. It just takes 1 second to know that. Some patients, if they are done right, you can't tell. And so they all is in the details how to perform the procedure.
What do you think makes your center stand out among all other hair transplant clinics?
Hair can be pretty difficult. That's why experience counts, and because it has to be done natural way. And I think sometimes I have discussions with the patient that it's better to be a little more conservative than being overachieving in this area, because again, if the hairline is put too low or too straight or it doesn't look natural, it defeats the purpose. Instead of creating a more confident individual, you're creating somebody who is concerned about it and is constantly thinking if people are noticing his hairline. So here the experience comes in, and I think that being in plastic surgery for so many years and dealing with the minute problems that for some people are maybe not of a concern, for my patients they are. So that's why I'm used to dealing with the small adjustments that really make a big difference.
How soon can someone return to normal activity?
That's another advance of these new procedures that are done with the robotic surgery and without scars, because the healing is very rapid. That means that everybody can be in the gym in 5 days if they want to. Pain is minimal, and really there's no typical edema and swelling of the head and face associated with the strip procedures. So once the wounds are healed, and this takes about 5 days before you're ready to hit the gym, ready to go back to work and to life, it's really no time. It's very minimal time involved. So I think for a busy young professionals, it's very important.
So a lot of people were really unhappy with the old strip technology. What does this new robotic technology bring to the table?
Yes, actually it's interesting that about 20% of procedures we perform is to help patients who underwent strip procedures. And they either want more hair done, and if you go and try to repeat the strip procedures, the scars get even worse because they get more tension, the scars get widened more. So for those patients who already had the strip procedure, still the new robotic version is much better, and because we not only can fix the scar, but we also can help them with more hair.
So a guy's not going to want his friends to know if he gets this procedure. How does confidentiality work?
Oh, of course. We deal with this all the time with the plastic surgery. So we have a private entrance, and we are located in a kind of quiet area with a private parking. And really, a lot of these patients can leave with the head on, so nobody really knows what was done. We have our staff that works for us full time, and they are always here available for preoperative, postoperative care. We're not going anywhere. We are here for years doing these procedures.
Okay, so if a guy has maybe missing facial hair, can he get the transplant procedure for that as well?
Yeah, there are other areas. Just like we transfer hair from the body to the scalp, we can also reconstruct the eyebrows, the beards. Everybody. I even had the patient who reconstructed some of the hair on the chest or on the abdomen because they wanted to make it more even or more presentable. So hair is really transferable. You can do it, in any way you want. And these procedures like robotic surgery or neograft, they allowed us to do it without creating linear scars. So either if you do it from the scalp or the chest, you're not creating very visible scars.
Now, I've heard some guys are worried about the robotic technology, that it's new, and they're waiting for it to be perfected. What are your thoughts on that?
Well, I think that it is a new technology, but it's not new to us. We have been doing this now for several years, and we've done hundreds of patients. And the robot at the moment only helps us with harvesting. It's something that is the most difficult part, because if you can imagine, it has to take out thousands of hairs, thousands of group of hairs, because they called follicular units, which are a group of hairs. in a very precise, repetitive motion. So for a robot, it doesn't matter if it's a first hair or 2,000 hair. Still, the transfer of the hair is done by hand, you know. So, but we have a lot of experience with this. You know, this is done for 15 years, so this is not something new. I think that if you are looking for, or patients are looking for a FUE procedure, not a strip procedure, the biggest advance of our clinic is that we are one of the first to start it. So we have a tremendous experience with these procedures, and I think it's nothing like experience. You're dealing with a lot of adjustments. So I think that's what makes our patients feel comfortable.
All right, cool, doctor. Thank you for your time.
Thank you very much.